CBT for OCD, how it works, examples, and effectiveness. Hi, I'm Michelle Risser, and I'm a licensed therapist, and today we're going over CBT for OCD. Cognitive Behavioral Therapy, CBT. CBT is a therapy approach that focuses on the connection between thoughts, feelings, and behavior. The idea is that by changing thought patterns and behavioral habits, CBT can start to improve the negative emotions. How does CBT for OCD work? CBT works to break the automatic bond between the obsessive thought and the related compulsive behavior. CBT also trains the person to avoid compulsions when they're feeling anxious. Here are 4 CBT techniques that are commonly used to treat OCD. Exposure and Response Prevention Therapy, or ERP. Perhaps the most helpful CBT tool for treating OCD is Exposure and Response Prevention Therapy, ERP. This process involves exposing the patient to the stress-inducing obsessive thought without allowing them to engage in the compulsive behavior. Deep breathing exercises. Breathwork exercises are exceptionally helpful for managing anxiety related to OCD and can be beneficial for use during ERP. Breathing exercises can slow down the breath and the heart rate, creating a calming effect. Progressive muscle relaxation. This is a process that allows a person to physically tighten and release tension throughout their body. Cognitive restructuring. Cognitive restructuring involves challenging irrational thoughts or thinking patterns and replacing them with more rational thoughts that are based in reality. Is cognitive behavioral therapy for OCD effective? Cognitive behavioral therapy has been proven to help thousands of people learn to manage OCD. In fact, ERP, which is a subset of CBT, is one of the only proven methods to effectively treat OCD. If you'd like to learn more about ERP for OCD, we linked a video we published on ERP in the description below. Research shows that as many as 75% of patients who seek ERP as treatment for OCD find it to be effective. How long will CBT take? The standard treatment model of CBT for OCD is usually about 12 weeks, with 1 hour-long session per week. It can take time depending on other mental health issues or traumatic histories. The key to success in therapy is trust between the therapist and the client and a willingness to follow through on homework and directives. Here are a few examples of the way OCD manifests differently and the treatment plan for OCD using CBT in each situation. Number 1. Fear of germs and illness anxiety. Angie is a 46-year-old stay-at-home mom who worries constantly about getting sick and not being able to care for her children. Her fear drives her to take extreme precautions to avoid exposing herself to germs. She spends hours every day disinfecting her home, and anytime she comes in contact with a surface that she believes is not clean, she feels compelled to immediately shower or wash her hands. Because of her hand washing, she has extremely dry, red, chapped, cracked skin on her hands. The therapist will explore any early experiences related to illness, cleanliness, and availability and health of caregivers when Angie was ill. They'll determine when the obsessive thoughts began and what was happening at that time. They'll discuss what benefits Angie feels that she gets from her obsessive thoughts and what she gets out of her compulsions. And then the therapist will use exposure to a used utensil or another item to identify Angie's intrusive thoughts. They'll work to challenge the thoughts using concrete reasons to understand how her behavior is harmful. For example, losing hours in a day or her dry and damaged skin on her hands. Angie will work to understand the consequences versus the perceived benefits of her compulsions, and she'll use these new thought patterns to guide her behaviors moving forward. Number 2, constant checking. Tony recently moved into his first apartment on his own, and he's starting college. He lives with checking OCD behaviors. Before he leaves his apartment, he checks the stove to make sure it's turned off. He walks to the bathroom and checks that the water is off, and then he turns the water on and off to make sure the handle is turned all the way off. He does this 8 times. Then he returns to check the stove again, ensuring that it is still turned off. He goes out his front door and locks it, immediately worries that the stove is on, and returns 2 more times to check it. He locks his front door, twists the handle 8 times, ensuring that it's locked and it won't open. The therapist will explore early childhood experiences that have to do with certainty or absolute, and also any exposure to trauma or any blame that was placed on Tony as a child. They'll continue to discuss the likelihood of an appliance being turned on after checking it's off, the reliability of his memory. They will continue to discuss together the likelihood of an appliance being turned on after checking that it's off, the reliability of Tony's memory, and how valid and confident he feels about it. The therapist will role play Tony's routine of leaving the apartment and challenge him to not recheck something, helping him to identify his intrusive thoughts. The therapist will explore with Tony why he questions himself and dissect the thoughts to reprogram them so he can challenge them as they arise. Tony and his therapist will work through what they've found when uncovering the underlying issues related to the obsessive thoughts and the coping methods to move forward without obsessions. How to find a CBT therapist. Many therapists are certified to practice cognitive behavioral therapy, so it shouldn't be too difficult to find one in your area. An easy way to find a therapist is using an online therapist directory, as it allows you to narrow your search by your location, the type of therapy, and whether or not they offer CBT. These searches can also provide a list of other factors you might want to consider, whether they accept your insurance and their hourly rate. You may want to ask about their CBT training and educational background, as well as how experienced they are with treating OCD. We've linked some valuable resources in the description below to help you find a therapist, psychiatrist, and other helpful tools.